Because I think the piece that I need to make clear is that the government does not run the healthcare system. The governments pay the bill. That's their function. They interfere almost not at all, actually, with medical practice. So one doc I interviewed a few years ago, the doc says to me, just go down there and tell your American docs if they had a system like ours, they'd think they had died and gone to heaven. I asked him, how long does it take you each week to figure out how much you're billing the province? And he actually sat there and calculated and said, about 45 minutes, right? Because everybody comes in, has a name and an ID number, and then there's a procedure code, and that all gets sent in the computer to the province. What's never been right with the system, and here's where a piece of an answer comes in, and that is it has never been truly comprehensive. Never. So that, for example, pharmaceuticals are not universally covered. Pharmaceuticals are covered for some of the population in some of the provinces, covered almost universally for people who are on public assistance, covered for some populations like seniors in some provinces, like kids in some provinces. This is also true of dental. This is also true of eyeglasses, okay? And what's never been in the system and has now, besides what they're now calling pharmacare, which they're really working hard to bring in, the other piece that has never been in the system is long-term care and home care. And those, of course, you know, when you think about it, when a country sets up a healthcare system, it sets it up in a moment in history, right? When healthcare is being done in a certain way. So if I set up healthcare in '62, right, and we set up Medicare and Medicaid in '65, we saw not very much allowance for pharmacare, for pharmaceuticals, because they didn't play the kind of role that they have come to play since. And this is a big weakness in the Canadian system. There is private insurance in Canada provided most often through employment for those services not covered under the Medicare system. What's also never been so hot, in my view and in the view of a number of other health policy people, but which nonetheless we would advocate for in the United States at this time, is the fee-for-service system, because it rewards procedures much more than it rewards what we would consider good primary patient care, listening to patients, developing relationships with patients, spending time with patients. So even within a few years of the systems coming in Saskatchewan, the authors of that book I was referring to earlier, Doctors Strike, talked about the fact that a doc could make 3 times as much money taking out your tonsils as, you know, listening to you and doing a primary care exam. So here's what isn't wrong with the Canadian system. Besides what I just told you that's always been good about it, it is not, you'll hear this stuff a lot, it's not unsustainable. That is, oh, it's getting more expensive all the time. If you actually look at the numbers, spending is under control in the public sector more than in the private sector, where costs have gone up somewhat more, not surprisingly. As to wait times, we hear that that's one of the great, great myths about the Canadian systems that we hear here. So we think that we have choice, but the fact is we have less choice than people in every other of the wealthy countries of the world, all of whom have some form of single-payer health care. For example, the Canadians pouring across the border for care that they can't get in Canada. And we hear that a lot. Well, the only reason the Canadian system works at all is that they have a safety valve. They can come here. Well, the fact of the matter is that 90% of the Canadian population lives within 100 miles of the U.S. border. Canadians come to the United States for lots of things, mostly not for health care. There are some arrangements made with some facilities in some U.S. states that make arrangements with the Canadian province. So the sort of very obvious example is that people in Windsor, Ontario, who are right across the bridge from Detroit, Windsor's a small city, if they need serious heart surgery, they go across the river to Detroit and have the surgery. The province picks up the bill instead of their having to go to Toronto or Kingston, which are hours away, or Hamilton, which are hours away, 4 hours away. So it just is a sensible kind of solution. So somehow that gets interpreted as Canadians pouring across the border. So if they can afford to, they get out. Lots of them go to Florida. They're seniors. They get sick. So they go to hospital in Florida. Used to be the province would pick up the whole bill. Now the province, I believe, depending on what province, will pay at the provincial rate. But typically what they'll do is negotiate with the U.S. facility before the Canadian ever has to see a bill. So as to Canadians pouring across the border, there was a nice study done in 2002. They looked at Washington State, Michigan, and New York and found that in 1 year, a total of 909 Canadians had sought care, 17% of those electively. 40% of hospitals on the border reported having seen no Canadians. Another 40% reported having seen fewer than one a month. A survey of 18,000 Canadians reported that 90 had received any care in the United States and only 20 had sought care in the United States. The notion that Canadian healthcare professionals, particularly docs and nurses, are streaming south to work in the United States is also not the case. It's a trivial amount. There are some doctors who come to practice in the U.S. There are some American doctors who go to practice in Canada. In the last couple of years, that the balance has been on the negative side. That is, more docs returning to Canada than leaving Canada. They'll come south and practice for a few years because they can make somewhat more money here, and that's very attractive. Likewise, nurses. And then they run home screaming because they just, you talk to Canadian healthcare providers and they say, they use words like obscene. The notion that you would ask a person whether they had insurance before you would treat them was obscene to them, was truly offensive to them professionally and from a humanitarian standpoint. If you get sick in Canada, you'll be treated, no questions asked. At the end of your treatment, somebody is likely to come up to you and say, "Excuse me, I really hate to ask this question, but do you have any kind of health care insurance? We don't like to ask, and don't worry about it. We'll make an arrangement." But because they just hate bringing this into the healthcare transaction, they hate it. They have to, because we frankly would bankrupt their system. The province of Ontario had to issue picture IDs because they found a lot of Americans were coming into the province and taking their friends' IDs and getting free health care on the province. And of course, not living, working, paying taxes there. There's 10 times as many of us as there are of them. We could bankrupt them in a week, right? If we all, and you'll hear, sometimes people will hear about health care in Canada and they'll say, "Oh, it was Jay Leno said last year, I've got a solution to the health care crisis, marry a Canadian."